Hi, everyone. Thanks for those that have been able to join us already. We're going to wait just another minute while folks jump on, and we'll get started here in just a minute.
Hi, Jeremy. I'm the other interpreter here with Clayton. Um, should the interpreter who is signing their camera will be on? The other one, would you like our cameras to be off?
Yep, that would be great.
Okay, great. Thank you so much.
No problem.
All right, good afternoon. We'll go ahead and get started here then. Thank you all for joining us. It's a pleasure to be able to be with you today and share a little bit of our plans and protocols for the upcoming semester as it relates to COVID operations, and really this opportunity to hear your questions and be able to respond to some of those, which is where we'll spend the bulk of our time together today. Before we dive into a very short presentation with some general content, I want to take an opportunity to talk about some of the event logistics and the features of the platform that we're currently on. As you'll see, your microphones and cameras are currently muted by default. We'll have an opportunity when we get to the Q&A for y'all to go ahead and turn those on. We can engage in that conversation face-to-face in the virtual format when we get to that time. At any point throughout the presentation, as well as the Q&A period, you can drop things in the chat. We've got a team of folks working with us that will respond to questions in the chat where we can share links and resources, and Dr. Ice and I will also pick them up from the chat and speak about them live as well. Additionally, you should see an interpreter on your screen now. There's also instructions on your screen to access live captioning if that would be helpful to you. You should be able to toggle your screen between the PowerPoint presentation and the video feed of folks that are on the screen by clicking the small box at the bottom of your screen. It will oscillate. So if you see a PowerPoint at the bottom, you should be seeing people on your screen and vice versa. You can click on that one to go ahead and switch those. Without further ado, to get things started, I will turn things over to Dr. Ice.
Good afternoon, everybody. Thanks for joining us. I'm glad to see that there's so many people here. And I just want to start to reiterate what Javanto said in terms of we're really here to answer questions but we did want to start with sort of a quick overview of the protocols because realize, first of all, a lot of people have been away for the summer and we need to get us back in the mind frame, but also many of you taught exclusively online last year, and so maybe didn't need to be as aware of the protocols as you will be now. So we want to make sure that you're aware of that. I want to make it really clear that we're using a multi-layered approach to prevention. If you ever watch any of the WHO press briefings, one of the things that they'll talk about is how important this layered approach is. And many countries have been able to successfully tamp down COVID even before we had access to vaccines, and many of them still don't. So you may have seen it referred to as sort of the Swiss cheese model. And the idea is that there's multiple, Swiss cheese has holes in it, so things can come through, but if you have multiple slices of cheese, eventually you block the holes. And so that's what we're attempting to do here. I will say also that this continually changes, and I know people have horrible change fatigue right now. I get it So do I. But we really are trying to be responsive. We every morning I get up and the first thing I do is look at all the data. And then I take some time to read, what people are doing, what's successful, what's not, what's the local context, what's the national context and the global context. And then what is the best available science that we have, which we know is evolving as we go through. And we try to work towards best practices. Sometimes we make choices that maybe not aren't best practices, but they're the best that we can do under the circumstances that we're in. There's always constraints that we have to work under. So again, I've mentioned this to a lot of people before, but we take a sort of very traditional public health approach in terms of using a primary, secondary, and tertiary levels of prevention, which is sort of the backbone of public health. So primary prevention, we want to prevent disease before it occurs, and we'll give some examples of that. Secondary prevention is really about identifying the disease, so testing, and then reducing the community impact of that disease. And then tertiary is really providing supports to manage the impact of the illness, because we know that people are going to get sick. We want to to help support people who are sick so that it has minimal impact and that they come back feeling well. Okay. Is this me again? Okay, thanks. I couldn't see the notes. So primary prevention, or obviously vaccination, is one of the things that we're really excited about. We have an incredible set of vaccines that are effective. Reduced effectiveness at transmission for Delta, but still more protective than being unvaccinated, and highly protective against hospitalization and death. But they're not the only primary prevention, and alone they're probably not sufficient in an environment where we have some people vaccinated and some not. So we still want to continue with physical distancing, hand washing, obviously cleaning, where we can limit crowd size, avoiding crowds when possible, and masks. As you know, we reinstituted indoor masking. I know it's not a popular decision for many people. It is an inconvenience. It's uncomfortable. I get that, but that's one of the best prevention strategies that we have. And when layered with vaccination, is an excellent way to reduce transmission. Also, if you can limit travel, that's a good thing to do. And we're going to work towards where we can de-densify campus in doing so. Okay.
It wouldn't really be a virtual meeting if I didn't start talking while muted, right? Our secondary prevention measures come into play when we know that folks have been impacted by disease, so that we can reduce that impact from extending to other areas of our campus community. And so here, similarly, right along that Swiss cheese model, we're using several different methods. One of those is testing to identify asymptomatic carriers, which enables us to detect things early, right, and limit the spread, prevent and mitigate some of those outbreaks. That also helps us support some timely contact tracing, isolation, and quarantine, so that there are less folks impacted by each positive individual in our community. Included in part of this, you may have heard recently that we're requiring all residential folks to test upon arrival here on campus. So that's one of the steps that we're taking in that testing strategy to help engage folks through that, in addition to the testing throughout the rest of the semester. We have the resources to get folks connected with diagnoses as they're experiencing symptoms. And I'll take just a minute here to talk a little bit about the contact tracing, the process that we go through when somebody is identified as COVID positive. So a member of our team will connect with each COVID positive individual and engage them in a case investigation. Part of that case investigation is to identify their close contacts. And close contacts are defined as folks that were within 6 feet of them, so physical proximity, for a cumulative time of 15 minutes, over a 24-hour period in their infectious window, so the 48 hours prior to symptom onset. And so we have staff that will ask questions about, what did you do in the 2 days that we're looking at here? And who was around, right? So that we can identify the folks that might be impacted and then get to them, right? Be able to provide them support and services while they're quarantining to hopefully prevent them from spreading on to other members of our community. What's really important here in the context of some of our academic spaces, as Provost Sayers outlined in a recent email, is being able to identify where folks are. So a seating chart or an attendance list is going to be really helpful to the CCL team in identifying who some of those close contacts are, making sure that we're able to get those folks out of the general population so that the spread doesn't continue. And then the tertiary piece comes in once we know that folks have been impacted, right? So I alluded to us working towards rapid quarantine and isolation. The faster that we're able to do that, the faster we're able to not just limit the spread, right, and that secondary measure, but also get this person connected to the support and services that they may need. And so we have a team of COVID campus liaisons that will work with each COVID positive individual, as well as each individual that is identified as a close contact or for some other reason is impacted by COVID, to ensure that they get connected to the support services that are going to be relevant for them. That may mean clinical care, right, and getting them to campus care for students or to their primary care folks. It may mean contacting faculty. It may mean getting them connected to academic, social, and basic needs support services. Our CCL team is going to work on all of that with that specific individual. So that's a little bit of our prevention planning and measures. Next up, we'll transition just a bit and talk a little bit about how to navigate this world. And so we have a faculty member that has spent the better part of the summer teaching in some of these precautions. So I will turn things over to Nicole to share some tips about teaching with a mask on. Nicole?
Hi there. Like you said, my name is Nicole Stumbo, and I teach in the nursing department at OU Southern. Now, we haven't taught this summer per se, but I spent the entire last year on campus in labs, and then we did some face-to-face with some clinical groups and some a couple of class meetings that had needed to happen on campus. And so I have had some experience with teaching in a mask. One of the things I would recommend is to find a mask that you like. And I have a couple of examples. So I have like my regular cloth face covering, which is if I'm going out into public, this is what I typically would wear. However, when I teach, I find that I suck this in my mouth a lot, and that's not really good for me to try to teach in. I feel like I'm always picking at it. So the thing that I like in place of it is this, it's an N95. It is a duck-billed style mask, and it allows, and where it is duck-billed, it does allow for me to feel like my words are coming out a little bit better. I haven't necessarily had any students complaining that they can't hear me. I feel like I'm fairly loud to begin with, but I do try to make an effort to speak a little bit more loudly when I am wearing my mask with my students. And then I'm a pretty animated instructor, so I use my hands a lot. I use my eyes. I get up and I move around the front of the classroom, and I think that that helps to counteract them not being able to see my face so much. But over the last year, I mean, we really didn't have any trouble. We ran successful labs without any problem. People wore their masks. We cleaned up, we stayed healthy, we stayed apart. And I'm looking forward to being back in person so I can get a better feel for my students. I feel like I can connect better to them when we are face to face, even if part of that is covered.
Fantastic, Nicole. Thank you.
So I know a lot of you are already tracking where the virus is increasing and so forth. The PowerPoint keeps hiding on me. There we go. So I know many of you are aware of that. And as you can, if you sort of watch the map that the CDC, I have a little screenshot of it here, just highlighting Ohio. But if you haven't seen these, CDC COVID tracker has this, and they classify yellow is moderate transmission, the orange is substantial, and the red is high transmission. And you've seen like the sea of red come from the west and then up to the south, and we're more and more surrounded by that red. And so we will flip to high transmission, likely before the students even come back. We're still seeing among the cases that we have there that are in Athens County, not a ton in Athens City proper, but that's increasing. So just to be aware of that, and all of the non-Athens campuses are also in high or substantial transmission. Southern is particularly getting hit hard right now. And when students come back to campus, whether it's to one of the regional campuses or come to Athens, we will see an increase in disease in campus, in our campus population. But I will say that our mitigation strategies last year were fairly effective. And so we actually didn't have a case of transmission in the classroom even before we had vaccine. So the combination of the mask and the vaccine and the distance are going to be really critical to keep everyone safe. And the testing also, by testing and rapidly quarantining people, that helps quite a bit. So it doesn't mean we'll have no disease. We're going to have some disease. We're making some changes to some of our testing protocols. I saw that there was a question about the turnaround time on the Vault test, which is 24 to 48 hours. So one of the trade-offs when you have tests, that is one of the most accurate tests on the market, but it does take longer to get results from. That's the trade-off that we made. And they also have the ability for a very high volume throughput. But we are actually in the process of reestablishing the CVS testing site, which is a rapid PCR test, a 15 or 30-minute result, which will be helpful. And we hope to have that here in about 2 weeks. What that allows us to do, one of the really effective management tools that we had last year was that when there was, for example, a case in a residence hall, or a couple cases in a residence hall, and we saw uptick. What we did is we pulled everyone either on that floor or that residence hall, depending on the pattern we saw, into the CVS testing to get that rapid result and move people quickly. That really helps stem the tide with outbreaks. We'll also do that in the case if we see a positive that was in a classroom. We will identify the people that are within 6 feet. Those will be contacts and they'll have to quarantine if they're unvaccinated, but we will bring in members from that roster in the classroom to test at CVS. So I think that the combo of those two tests are going to be really helpful for us. And we're exploring a third option for other uses. So hopefully that will help manage it and hopefully address some of the concerns about the Vault testing that came in earlier. I will say that it's not just about the cases. We are closely tracking the hospital situation. A lot of states to our south and to our west are reaching hospital capacity and perhaps even surpassing capacity on diversion. And I think there are some hospital systems that are experiencing similar in Ohio already. For Athens folks, Oblenis seems to be doing pretty well, but I don't know about the hospital systems in the other counties. So, and then of course, once we hit flu season, we're always worried about that. One of the side effects of everyone wearing masks last year was the fact that we didn't have a lot of flu. And so hopefully that will help again. So I think that's, oh, you have one more. Oh.
Yes, thank you. And so by way of transition, as we get to the Q&A portion of our time together, We've gotten a lot of questions from folks about what they can do. What are the things that are within our personal and individual locus of control to be able to manage and mitigate some of this? And really, there are things in each of those primary, secondary, tertiary categories that we've talked about up to this point that folks are able to take into their own accord, right, and engage in some of those prevention and mitigation measures. So certainly, as Dr. Ice alluded to, getting vaccinated is a powerful tool that we have in that primary prevention measure that folks are able to take advantage of, that we have fairly accessible throughout the state and certainly in the Athens and region. Thinking about secondary measures, and I saw a couple of questions come in the chat, so I'll try to answer them generally here as we talk about some of the contact tracing, seating chart type elements, and then we can certainly talk about them some more in greater detail as we talk about the nuances in the Q&A. But yes, the distancing in classrooms is 3 feet. And so as you heard in kind of the identification of what a close contact is, which is defined and identified by CDC guidance, that's the determination that our team is using in the contact identification case investigation portion. And that's the work that Athens City County Health Department has worked with us to develop, right? So that's the threshold that we're using. It will be helpful if we have seating charts to be able to identify who those folks are, because that will limit the exposure, right, and the potential impact to other members of the campus community. So if a CCL case investigator in that context is able to connect with the faculty member and identify these are the folks that were sitting next to a particular individual or near a particular individual, then we know that the rest of the folks in that class, right, are not close contacts or were not impacted in that way. I also saw some question around small groups and whether attendance rosters and or seating charts are better, right? One better than the other or more helpful. And really this depends on your pedagogical approach. And that's the determination to make first. And then we're happy to partner with you to help identify the COVID mitigation strategies that are going to work within that approach. Because there's ways to do it that are going to be, that are going to fit depending on how you've designed the course. So faculty folks should think about, you know, their course design, and then, right, like at that point, we can factor in some of the prevention and mitigation measures. For some folks, a seating chart is going to make good sense. If for other folks, you spend most of your course in small groups, then perhaps a roster of who's in which small group is going to be more applicable for you. So you'll utilize the pieces there that are relevant in your space. And then that tertiary step is really getting connected to resources, mitigating both the impact on you if you are impacted by COVID, and the spaces that we can control for other folks. So if somebody in your course or a student that you work with is impacted, accommodating, right, and being flexible in those spaces where you can is something that is a very effective tertiary measure. And so I'll switch the screen here as we activate your microphones and cameras. If you're looking for additional resources, certainly the PowerPoint will be accessible in the chat here, as well as some of the links that we've shared throughout and our contact information. But at this point, I'm going to go ahead and stop presenting so we can open it up for questions. I see lots have come in the chat, so we'll kind of begin the Q&A here.
So let me just clarify, there's some questions about 3 feet and 6 feet and who quarantines and who doesn't. So we've set the guidance and the rules that we follow based on Ohio Department of Health and CDC, and And to Vinny's point, like, will that change? Maybe, but it hasn't right now. We don't have the ability to change that ourselves for legal reasons. So anyway, if you're within 6 feet, you're considered a contact. So we made some challenging decisions with the goal of getting as many students in a face-to-face instruction as possible, that we went down to 3 feet. But there will be people then, students that would be within that 6 foot perimeter that they would have to quarantine. One of the reasons why we've asked faculty to stay at 6 feet is because to avoid faculty being quarantined. Now, I saw some questions also about faculty either having to quarantine themselves or isolate themselves, or if they have a family member that has to do that. And this would be treated just like you would do for any illness, of course. You would contact your department chair and say, I'm not available to come in. We also do notify when faculty, staff, or students are not allowed to come in or not able to come in. We don't tell them why. We just say so-and-so can't be here. And that goes to your college. Each college has representatives. And so then you would initiate whatever you do with your other faculty to either you can teach online if you're healthy enough to do so, or you can ask for a substitute, or you can have an assignment, just like you would do if you had the flu or any other thing that took you out of the classroom. I certainly spent a lot of my early years being out from class from my sick kids. So, so that we understand that's going to happen and all the normal channels apply. And I want to point out, some people asked, or somebody noted that we have all these services for students and none for faculty, staff. And actually that's not true. Our services are for students, faculty, and staff. And certainly if a faculty member is struggling to figure out, like, how do I manage this? That's what the CCL is there to help you brainstorm. Sometimes you get in a moment where it's just hard to think through what you need to do. And that's what we're here for, is to help you with that. So
I see a couple of questions that have come into the chat, so I'll jump in here, Dr. Ice. I saw a couple of questions about classroom spaces and the physical setup, which, yes, there is guidance that we shouldn't move the chairs, right, and the furniture in spaces because they've been specifically set that way by our facilities teams. And yes, cleaning does occur daily in all of those spaces. And for many, for the vast majority of things, that cleaning is going to be sufficient to prevent COVID, just like it is for the common cold and all of the other pieces that we navigate. The only exception to that is if somebody is actively sick or vomiting in a room, then you're going to want to let us know. We'll close that space and make sure that we do some additional cleaning. The best way to do that is, again, to call our office or to complete an incident report form. We'll get that managed as well. But for folks kind of navigating in a space, the standard cleaning will be sufficient for them. The other piece that I saw happening in the chat, some questions around mask compliance and how to engage folks in conversations around that. And so that's one of the things that we're working on currently, and we'll have some tips and some guidance on how to navigate those conversations coming out eminently. We'll gear some of that specifically for faculty in the classroom spaces, but that's going to be true for all of us, right? Whether that be in the classroom or in an office or walking down the street. So we'll have some more on that coming out shortly.
There was a question that it's hard to go through all these, but we're doing our best here. There was a question about the rationale behind asking students about their vaccination status. And I understand it's interesting because this is, as you know, a very hot topic right now. There are people, including faculty and staff, who feel very uncomfortable about sharing their vaccination status. And one of the things that certainly peers to peers, it's fine. One of the reasons why our legal office has advised us to not ask students, for a faculty member to not ask students, we have that information and we're managing compliance on our end, is that there's a power imbalance, right? You hold the key to their grades, and so it places us all at risk of a discrimination claim around vaccine, and then particularly once House Bill 244 goes into effect on October 13th, that's going to be potentially even more so. So it's not just about their discomfort, and I understand your safety, but here's the deal. Whoever has a mic on, please mute it. So one of the things that you have to realize is, yes, I understand your concern, but if you're vaccinated and you wear a mask and you stay 6 feet away from people, your risk of getting the disease is low. We remember that we have this Swiss cheese model, and if you ever watch WHO, Maria Van Kerkhoff is amazing. She'll talk about this, like your safety is in your control if you take those measures. I completely understand the anxiety around this. I completely understand the worry. Many of us have health conditions that place us at greater risk, but the combination of all these factors will help protect us. We are testing those students, and we are holding them accountable for that testing. So I understand, Bill, that might not reassure you. I totally understand that this is hard, but it's not about feelings. It's about a real risk of liability.
So I'll jump in here with a couple other questions that I saw come in the chat. The first was around signs on the doors to buildings. Thanks, Teresa. We do have signage available to remind folks that masks are required in indoor spaces, as well as a number of the other COVID precautions that we're taking. And so there's a link that we'll get in the chat here so that folks can access with that signage pre-made that's available to faculty and staff. I saw Shelley asked a little bit about if our students, if you're a parent and your child is COVID exposed or COVID positive, what's your role as a university employee at that point? And it depends a little bit on kind of where your child is and where you are. So I'll kind of talk through some of the various options. But the short answer is to give our office a call, and one of our staff members can walk through the relevant specifics for you and your child and make sure that we get the right plan sorted out for moving forward. So if your child is exposed to somebody that is COVID positive, that means that they're a contact. They will need to quarantine, and there's no direct impact on you at that point, other than you have a child at home that's quarantining. And certainly, right, there's the childcare elements that come with that. But you yourself, as a contact of a contact, would not be expected to quarantine at that point. However, on the flip side, right, if your child is COVID positive, it is quite likely that you've had a cumulative 15 minutes in the last 24 hours of contact with them. And in that instance, you would likely be identified as a close contact, and you yourself would be expected to quarantine. Either way, right, again, you're going to go ahead and call into our office. A CCL is going to be able to walk through that process with you, help identify the appropriate determination if you are a contact or not, and talk through the next steps for that moving forward.
So one thing that I saw was a question about vaccine mandate. Now I'm gonna take a moment to talk about that because that certainly has been a lot of questions. And as you can imagine, I hear from a lot of people like, just mandate it and don't you dare mandate it or I drop out of school. You know, it's very polarized right now and it's a challenging environment. So to be perfectly honest, we are talking about it. We are weighing the pros and cons. Sort of, you know, my epi self is saying to me, we just need to mandate it because we'll get more people vaccinated. And certainly, you know, epidemiologists like to think in the black and white, the 1 zeros. But I also have training in anthropology and global health. And that side of me is saying, but these are people. These are people, and we know from global health that when we mandate things or we outlaw things, it can often backfire and actually get less desired results than if we engage with people. And so ultimately where the university leadership will fall on this, I do not know. We are discussing it and we have to weigh all the pros and cons. There are consequences to any decision that we make, and we're trying to balance those. It's not as easy of just do that or just don't do that. Things have to be weighed, and please be assured that we're doing that. We're actively researching, looking, thinking, and we'll do the best path that we can. So so there was a question about the 3-foot distance in the large lecture halls. We've actually been working on that quite a bit. This is a challenge particularly for the stadium seating, kinds of the theater type. We weren't able to get in some cases exactly 3 feet because they're fixed seating. So we capped it at 75% capacity, and enrollments have been low enough that actually we're not reaching up quite to that 75% in most classes. Where we are, we're exploring different rooms or different configurations. We're also discussing capping those classes at the enrollment that they are now, so that we can space things out a little bit better. And then we will relabel the classrooms accordingly. It's just a really tricky thing to navigate, because those happen to be classes that we have a lot of students that want to be in. They want to be in person. We have faculty workload restrictions, so we can't ask faculty to continually add multiple sections and multiple sections. Hybrid is a modality that's possible. High flex is possible, but those are also taxing. So we're just trying to figure this all out. And Molly, specifically, we will be getting back to you with your classroom concern.
I saw a couple of other questions come into the chat. One around course modality and folks that are teaching in person, but may have students that are unable to attend in person for a period of time due to quarantine and isolation. And that's something that we know folks that have been teaching have navigated leading up to this point, and we know that it's going to continue to be something that we have to navigate. Truly, that is a case-by-case determination that the faculty member is going to identify what's feasible, right? What's possible in that particular course. There are some courses that it's easy to, or easier, I should say, to transition some of that content online for folks so that we can be accommodating and supportive of their continued academic success, while also ensuring the physical safety of students, faculty, and staff while they're quarantining or isolating. And there are other elements that may need to wait until they conclude their quarantine or isolation period. So really, we encourage students that are impacted by COVID in that way to work with their faculty members and identify what that's going to look like. Again, we're happy to consult, right, and provide some context or resources or suggestions on how that might be helpful or possible to navigate, but that's going to look different in every scenario. There were also some questions around ventilation. We'll post the link to the update, the information about that in the chat. Our facilities teams have done a fantastic job of assessing all of the spaces on campus, both on the Athens campus and in our regional campuses, to ensure that they're adhering to both the requirements, right, by building code and the best practices that we have across the state, or excuse me, across the country. And so we'll get that information in the chat so that you can review it, but that has been conducted, right? We know that that process has occurred. And then I saw another question before I kick things back over to Dr. Ice about holding folks accountable for testing compliance. And so as we alluded to earlier, There is an expectation that folks test, and we will be holding individuals accountable to that. What that process looks like, to answer Nicole's question explicitly, does include a restriction of access to campus facilities. So the first time that somebody misses a testing window, a member of our team is going to reach out to them and try to engage them, figure out what happened. Because we know that sometimes folks simply forget. It's possible that there's a barrier to testing, and so we want to be able to address those at the outset when that is the case. So folks will receive a phone call, a text message, and an email, providing that we aren't able to connect with them when we reach out via phone call with that first outreach. Then they'll have a 3-day period to go get tested, to come into compliance with those expectations. Provided, again, that they don't at that point, we'll reach out again. There will be another opportunity for them to come into compliance, this time a shorter period, a 24-hour period, after that second intervention for them to come into compliance. And of course, we'll continue that process for students. If they continue to avoid compliance, they will be referred to community standards and student responsibility and held accountable for that as well.
Okay, trying to see. Quick answer to the booster shots. Yes, if booster shots are approved, we are already discussing with the health department and Ohio Health. We work very closely, the 3 institutions, on how we would actually facilitate booster shots when they become available. I think that the science for booster shots is not sufficient yet. And there's certainly an issue of gross global inequity in access to the original shot. And so I think that's something that CDC and others are navigating. So I don't know when they will approve it. We can't do that until it's approved to do so. The FDA hasn't approved the booster shots yet. So we're closely watching that, but planning in the background so that we're ready to roll. I saw there was a question about the mask exemption. Yes, we legally have to provide a mask exemption. We get a lot of requests for them. There's 2 avenues that they can get an exemption. One is religious. It has to be a sincerely held religious belief, and they actually talk with legal to in equity, blanking on the acronym. Anyway, they have to discuss this. It's not just like I say, I don't want to wear a mask because of my religion. There's a process. Same thing with medical. They actually have to have, anyone who wants a mask exemption has to have a medical excuse faxed from a physician that says why they can't wear one. And then they go through the same accommodation process that anyone would have. So that doesn't necessarily mean that they'll be in the classroom without a mask. They may be accommodated by having online classes. So because we are trying to keep everyone masked in the classroom. If a student says I've been exempted, then I would ask them for documentation of that exemption from our office, or you can check with me or our team, and we can let you know if that's the case. So
I'll jump in here. I saw a couple of different questions come in. One about notification of student positive COVID tests and whether notification would happen to faculty folks, right, and others on campus. And so we're following the campus partner notification process that we've used through the last year of the pandemic. We will notify the identified contacts in each academic college, as well as several other areas of folks that are unable to engage in campus activities However, I think it's important to note that unable to engage in campus activities doesn't necessarily mean that individual is COVID positive, right? It's important that we respect their privacy as much as possible. And so that notification is going to include folks that are COVID positive, which may mean that they are physically ill, right, symptomatic and unable to engage in even virtual activities, or that they're COVID positive and otherwise feeling fine and need to stay in their room, but are able to engage virtually. It will also include folks that are identified as close contacts, that are identified as folks that need to travel quarantine or in other ways impacted by COVID, as well as folks that are non-compliant with asymptomatic testing, which we talked a little bit about earlier. So all of those folks will be unable to engage in campus activities and will be included in those notifications. So if you have questions about where those notifications go in your specific unit, or if you're not receiving them and believe that you ought to, go ahead and reach on out to us and we'll get that sorted out for you. The other piece that I saw relatedly in the chat is a question around vaccinated individuals and the need to quarantine. So y'all may have seen in one of the recent updates of CDC guidance that fully vaccinated individuals will not be expected to quarantine after exposure. They will, however, be expected to test and to monitor for symptoms. And so we're still going to engage with those folks. We're going to ensure that they are testing on that schedule as indicated, that symptom monitoring is occurring to maintain the safety for our campus community. But yes, you've accurately identified that is one of the really positive tools that we have to minimize that academic and social impact of not needing to quarantine in that scenario.
Okay, a few things that have passed by me quickly. Somebody asked for the pathway results and I'm trying to get a copy of that to pop in here. I will put in another plug that faculty actually have been the least willing to submit their pathway. And so we really need you to do that. Please, please, it affects all of our planning to know what the level of vaccination is in every single group on campus. So again, please fill that out as soon as possible. And then there were some questions about infectiousness of Delta and the vaccine, how well the vaccine holds up. We do know that the R0, so the reproductive rate of Delta seems to be between around 5 or 6. Vinny Just has given me some great models. He's a great resource also, that the effective transmission rate in Ohio is not quite there, but it's often hard for us to know the actual R0 in real time because there are a lot of people that are infected that aren't tested. And that's another reason why it's a bit difficult to know how well the vaccine holds up, because many people may be infected and asymptomatic that we don't identify. But by and large, the vaccines were designed specifically for severe disease and death. They've never been sold as 100% effective. I think some people have said that, but that's not accurate. And so really they are holding up. In Ohio, I think Dr. Vanderhoff mentioned that something like 94% of the hospitalizations are in the unvaccinated. So they are holding up for that purpose, but you can still get the disease and you can still transmit it. The viral load is similar in the beginning, but it drops very quickly among the vaccinated. So hopefully it will hold up fairly well. But one of the things that we are adding to our testing strategy that we haven't announced yet, but I'll tell everybody here, hopefully you won't get in trouble, just kidding, is the fact that we are going to start a voluntary testing of people who are vaccinated. We're going to run it as a stratified random sample, if that means anything to you data geeks on the call, but what we'll do is pull a random sample and invite people to test. This will not be part of the compliance process. We may get to a point where we'd have to shift gears on that if we see a lot of breakthrough, but this will be really essential for us to determine what level of breakthrough we have. So if you get called to come in and test, and it wouldn't be more than once a month, we'd ask you to do that. The other thing that a number of people have asked me around testing is that they're personally concerned and they want to continue to test. And so you absolutely can continue to test at the cadence that you feel is important. I think we did send you some recommended language for the syllabus. We can double check that and put the link in there. And the other thing that was asked about, why aren't we testing people before they come and rather than on arrival? It's not ideal or where we want to be. We simply couldn't pivot that quickly. We knew we wanted to test people when they came in as fast as possible. We're rapidly trying to get some rapid tests to see if we can get that for the bulk of the move-in. I'm not sure we're going to get there. So unfortunately, we weren't able to do like we did in the spring, the vault testing in advance. We just didn't have it set up because we designed this all at a time where we're in a different boat. I expected that we were going to have a surge for sure. It's a little bit earlier than anyone had modeled, so that we're all sort of caught back. And the other thing that I will tell you that a lot of people will say to me, well, Ohio State's doing it this way or Miami's doing it that way. Actually, I talk with public health folks in the IUC schools quite a bit. And particularly there's a core of us that meet and talk on a regular basis. So a lot of our decision making is informed from not only my own personal research, but pulling on the resources of the Ohio State public health team, Miami, Kent, and others. So be assured that we're aware. Oftentimes I know what they're doing before it's publicly announced, and it does help us consider how we're going to move forward.
So I'll jump in with a question that came in earlier in the chat around the timeline of things and asking about notification. So as soon as we become aware that somebody is impacted by COVID, either having tested positive or identified as a close contact, our team's going to reach out to them. So that same day, right? Typically within hours of us being aware of that. The campus partner notifications piece, and when you might be aware that somebody else in your community is impacted, is once a day in a batch, right? So that's an administrative process that will happen once each weekday morning. The other piece that I saw in the chat here asking around testing, I'll go back and reiterate that everybody that gets to campus, that's moving onto campus, is expected to test within 24 hours of their arrival. So we do have the testing set up. It's on campus in Shively, the testing center that we've been using for the last couple of weeks here. That will continue to be the expectation for folks as they move onto campus. I also saw a couple of questions around like a threshold rate. And I'll let Dr. Ice respond to this, but I'll tee her up by saying that there's lots of different factors that we have to consider. There's not one data point that we can say, if this, then that. Because of the rapidly evolving understanding of COVID, the rapidly evolving epidemiology, and the data that we have at our disposal nationally, at the state level, and locally, Dr. Ice looks at that every day. And so we're constantly in a state of evaluation of what that looks like. But unfortunately, there's not one clean, cut and dry data point that we can give y'all to say, if this, we need to take these steps. Dr. Ice, I don't know if you want to.
Yeah, thank you for that. It is really tricky. I know everybody really wants a signal, and we had thrown something out earlier in the spring, and we're hoping that we could get to 70% vaccination status and cases below 50 per 100,000. and that we could remove the public health measures. And of course, the CDC changed their policy and we were sort of hamstrung on what we could do. So we shifted gears. Now most epidemiologists are saying that we probably need to get to 80 or 85% vaccinated or even more to have herd immunity. And so certainly that's a reach goal, but even with the schools that have mandated vaccine, they're not getting to that level. So this is one of the challenges. And the other thing is it depends on how people are moving, the virus is moving, the variants and so forth. So we may very well get to 75% vaccinated and the case rates bottom out. And then we are in good shape. So I am evaluating this every day. I talk quite a lot to my colleagues, and we battle this. We bat around these different ideas. It's a dynamic thing, and I think it's better. I understand people want clear goalposts. It's easier to say, to look in the black and white and the 1-0. But ultimately, we want to look at the whole context to see that we're managing disease effectively. What we really want to reach, and this is a WHO goal as well, is the point where we're able to manage disease so that it's just a little flare up here and a little flare up there, and then you can deal with it. We probably never will be completely rid of it. But if we can manage these little pockets, we're in a better spot. Right now, we're of course in widespread disease, and that's where we don't want to be. So we're working on that continuously.
I saw some questions come in the chat that either will be addressed soon or have been addressed earlier in the chat. So I'll kind of do some housekeeping here as we near the end. Somebody asked about the upcoming House bill and what the ramifications of that are. I think Meredith shared in the chat earlier a little bit of a primer of House Bill 244, give you some general information there. And so we'll go ahead and get that relinked in the chat for folks that want to access it. I also saw a question come up again around engaging students in the classroom for mask compliance. And so, as I mentioned earlier, that's something that we're working on now. Look for another communication coming imminently that will provide some additional guidance on how to navigate that situation and what resources are at your disposal. I'll also acknowledge that there has been a lot of questions. I know we've answered many of them out loud, but certainly not all of them. We'll go ahead and get our FAQ page linked in the chat again, which will answer many more of them. We're going to go ahead and review that, right, and provide some additional updates in a mass setting, right? We'll include that in our upcoming communications. If you have a very specific question that you feel like wasn't covered here or some additional pieces to that, go ahead and again, give us a call or shoot us an email. And Dr. Ice or myself or somebody from the team will go review those and make sure that you get an individualized response to that information as well.
Yeah, I will encourage that. I know many of you on the call have already had extensive email conversations with you or phone or in person even. So I am available and will help answer questions that I can. We also really encourage people to take advantage of the website. There's a lot of resources there. I know everyone sort of shut off over the summer, but it's there, and certainly we try to give any updates in the messages that I send as well. And for House Bill 244, just as far as the consequences of that, I just want to very quickly say that it would affect us being able to treat people differently, whether it's testing, masking, distance, based on their vaccination status, as long as we don't have full FDA approval. Lots of positive signs that we will have Pfizer approved in early September. Moderna should be right after that. So we're sort of hoping that we'll be approved and we'll be in a different spot. But we have a testing, like the testing strategy that we're using for the voluntary testing right now will become our testing strategy for everybody if our hands are tied. It's not ideal. to go that way. So we're really super hopeful that we get to a better place with approved vaccines. So again, like I said, I am very, I can ask you, so let me just answer the question about legitimately asked for student vaccination status. So where we have asking about student vaccination status in certain programs, so for example, nursing, right now you cannot get a clinical placement in most places unless you are vaccinated. So the nursing department will collect that information or coordinate with us to get that information to the hospitals as needed. Theater, there's a show that you can't participate in because of the Actors Equity Guild union that you have to be vaccinated. So in that case, it's for a reason. Many study abroad programs now, third parties are requiring it. So it's in those situations where there is an experience that we have to document that for. Just to know for your own curiosity, to ask students because you're worried about your health is not considered a reason to ask. We're working on solutions. So if you want to know like what percentage of my class is vaccinated, that we could probably do that. Can we do that for every single class? Probably get overwhelmed, and it's probably resources that you want us to use elsewhere, to be honest, but we can certainly try to allay some of those fears to the extent possible. So I think with that, we are a little bit over time. I saw some requests to summarize, and we will work on that. And appreciate everyone coming and putting out the questions. We really are listening and trying to respond to everyone, to all the constituents. Remember that all of you have your personal perspectives, and there are, 345 other perspectives on this call, and we try to navigate and deal with those. So thank you very much for attending. And Tim, why don't you shoot me a message? Anyone who didn't get a question answered, please send me a private email, and we'll get those answered for you. So thanks, everybody.